Hi everyone, we're here to talk about COVID-19 and kids. And I've got Dr. Asha Bowen and Dr. Chris Blyth to talk to about this. Asha, let me start with you. Is it safe to send our kids to school?
Well, my kids are at school today and I think that that's the best place for them to be at the moment. The reason for that is that we know that kids can get infected with COVID-19, but they don't get nearly as sick as we're seeing reports for adults. We also know that in most of the studies that have been coming out very quickly, it's a transmission from adults to children rather than children to adults. We often fear that in respiratory viruses, the kids are the ones who are spreading their snot and really infecting everyone else in the community. We don't know that that's the case for COVID. So I think right now kids should remain in schools and that they should be able to do their normal activities to the best of their ability in order to keep them calm, confident and able to sort of do their thing while we're experiencing this.
But they can still get infected in schools, can't they? And some kids are getting sick.
So in Australia so far, we have seen children who have become sick. In some of the school settings, we know already that where a child has been detected to have COVID, their classroom contacts so far have not been tested to have the infection. So the school setting is not the best place for transmission of the respiratory virus, but I think our confidence around that is only very preliminary. It's only new information, and as we learn more about this virus, as we, I guess, experience it, we will have to find out more things. I know so far that schools are really pushing hand hygiene. The kids are washing their hands regularly throughout the day with soap and water, that they're asking kids who have any respiratory symptoms or any features of being unwell to stay home, and they're really looking at the same social distancing policies that have been implemented in the community within the school playground. So separating the kids so that there's no assemblies and that the children don't all have the playtime at exactly the same time in order to, I guess, reduce those opportunities for infection to occur, but really to remain that sense of calmness and that sense of confidence for children right now.
And in some ways, I guess schools are almost an easier place to practice those sort of social distancing, hygiene practices. Chris, can I ask you, there's also some potential negative connotations about closing schools, aren't there? That there's, kind of what happens with those kids if they don't go to school. What sort of problems might arise if we chose to close schools?
There's a number of potential problems. I think the biggest problem is what to do with their parents. Many of our essential services, including hospitals and healthcare facilities, but much broader than that, are clearly reliant on adults coming to work at the moment. And if adults are at home caring for children, that could be a major problem as far as services. If adults need to come to work, who would be looking after those children? Well, potentially grandparents could be looking after those children. And we know that the elderly are probably more susceptible to this virus than younger people. And so that's something that we want to avoid as well.
So, Chris, schools are remaining open, but are there some children who really should still stay home from school?
I think the guiding principle is children who are unwell should clearly stay home from school. They may have a respiratory infection and clearly those children are at risk of transmitting it to other children. I suppose the question asks, are there specific groups of children, particularly those with underlying chronic medical conditions, who should stay at home? We don't know whether those groups of children are more susceptible to this infection compared to normal children. So my advice at the moment is they should be going to school, they should be maintaining their normal activities at this stage. However, we would advise against large public gatherings and things like that where the opportunity for transmission is much greater. But to answer your question, I would be recommending they go to school at this stage. That may change.
And could I ask, I know that there are some parents that are wanting to send their kids to school in face masks. And these are healthy kids. Maybe, Asha, what do you think about that?
Well, I think face masks in the classroom will probably be a bit scary for some of the other kids. And we know that face masks are really useful to prevent children with symptoms from passing that on to other people. We don't want those children to be coming to school anyway. So wearing a face mask for a child who is asymptomatic or has no symptoms at the moment doesn't really help stop them transmitting the virus, and we're not 100% confident that it would stop them from getting an infection. So by the time it's been worn for the whole day, it probably gets a bit manky and moist, and that means that it probably isn't as protective as it was when they started at the start of the day. So I think at this point in time that face masks in the schoolroom are not being recommended.
And Chris, am I correct that this bug is not like other bugs that it floats around in the air, that's not actually how it's transmitted?
The evidence suggests that this bug is largely transmitted in droplets. So in other words, when you cough and sneeze, you generate small droplets of moisture. The virus is in those. They don't travel very far. They travel close around you, and that's how you pick it up, either by being exposed to one of those droplets or touching on a surface and then taking it to your nose and your mouth. So it's very similar to many of the other respiratory viruses we see, and the major form of transmission is by those droplets. So cough etiquette and hand hygiene are the most important preventative messages.
So it makes sense that if you've already infected, you don't want to be coughing out, so that might be the right person to use a face mask.
That's right.
But if you're walking past someone, the face mask is really not what you need, it's washing your hands.
Yep, you're exactly right. The evidence that in the community face masks prevent acquiring infection is not great, and so that's why we don't recommend them at this stage. But if you are infected or you have infectious symptoms, yes.
But presumably this is a changing feast, Asha. This might change?
Yeah, I think it's something that we're having to watch this space on a really regular basis. We know internationally that schools have closed. We know that there are some countries where schools haven't closed, such as Singapore, and that they've been able to really get the transmission under control. There are other countries where schools have closed and reopened, such as South Korea, and then there are countries that are just at the start of closing schools. So I think that that is something that our health leaders, as well as our politicians and community leaders across Australia, are really thinking about on a regular basis. And as information comes to hand, that decision needs to be reviewed. So it is that schools remain open for now, and I strongly support schools remaining open, but it could change, and we all need to be aware of that and to be ready for that.
Look, thank you both. This is obviously a topic that all parents are worried about. For now, it looks like schools remain open, but it's a moving feast. It might change in future. This will be one of a number of these sorts of videos where we'll be updating you on a range of different things around coronavirus. It does change regularly, so stay tuned for the next installment. Thanks very much.